This talk is intended to contribute to Oregon's efforts to significantly reduce substance use and other problems among children and adolescents. So, preventing substance use and related problems in childhood and adolescence. Oregon has a significant problem. Here's data on adolescent substance use in Oregon. The data from 2023 indicated that 29% of 11th graders reported consuming alcohol in the past 30 days. Among 8th graders, the rate was 11%. 14% of the 11th graders in Oregon reported engaging in binge drinking, which is defined as consuming 5 or more drinks in a row. And binge drinking is predictive of the development of alcoholism and other problems associated with drinking. 23% of 11th graders reported vaping nicotine, and approximately 20% of 11th graders used marijuana. And there was a distinct shift towards them getting it via vaping as opposed to other methods. And last but certainly not least, in 2023, there were 106 unintentional opioid overdose deaths among those between 0 and 24 in Oregon. So we have a problem, and what I hope to do is describe the nature of the problem and what can be done about it. I think there's good reason to be optimistic that we can make a difference. I'd start with this. The National Academy of Medicine did a report in 2009 on prevention, and what they concluded, and it was interesting, I was on this panel, and there were 2 leaders of it who were not prevention scientists. They were there to sort of keep us honest, and they were happy to be skeptical about the evidence. But by the time we got through reviewing the evidence, they agreed to this statement that every child, that if we use the science that we have, every child could arrive at adulthood with the skills, interests, values, and health habits that it would enable them to live a long, healthy, and productive life in caring relationships with others. And that's kind of been my vision for what we can do. And since 2009, I've been working to try and get these effective preventive interventions widely adopted, because there's a huge gap between what we know and what has been shown to work, and it's actually being used in our communities. So here are the key points. First of all, adolescent substance use is related to most other psychological and behavioral problems of youth. We can't prevent substance use by focusing narrowly on just this problem. We have to recognize that substance use occurs in the context of other problems. But the good news is that if we have a comprehensive system that addresses all the problems, we'll have a bigger impact on substance use. So if your only concern is substance use, you should be concerned about the entire range of psychological and behavioral problems that undermine the well-being of our children and adolescents. And then the next point will be stressful family and school environments can be devastating, and I'll talk a lot more about that. The 2 most important preventive interventions are evidence-based parenting programs and evidence-based school programs, so I'll talk a lot about those. And then lastly, I'll talk about several other states that are doing significantly better at prevention than Oregon is. And hopefully we do have the resources in this state and the knowledge, and if we organize it and apply it effectively, we can have a huge impact on the well-being of our young people. So the first thing is to understand is that problem behaviors are highly interrelated. This is a study we did of 10,000 Oregon 8th graders. And we asked them about their substance use, their antisocial behavior, their risky sexual behavior, their depression, and their eating disorders. And what we found was that, and I'll just focus here on substance use. If a kid said that they were using substances, they were 5.5 times more likely to report antisocial behavior, 8 times more likely to report risky sexual behavior, nearly 4 times more likely to report depression, and more than 2 times more likely to have eating disorders. All of these problems are interrelated. And so it gets back to what I said earlier. We need to address each of these problems, and in doing so, we're likely to prevent other problems. Next, I want to talk about two distinct developmental pathways. It turns out that human beings have evolved to survive dangerous environments. And when they encounter dangerous environments, it results in a whole bunch of changes in the physiology of the person that enable them to survive in the short term, but actually shorten their lives very consistently. And the other is when people are raised in nurturing environments, those things don't happen. And so we have to understand these two pathways, and we need to, and prevention is basically a matter of preventing the pathway that has to do with the exposure to stress. So let me talk about those a little bit. So the first has been called the fast developmental pathway, and it goes something like this. Families and schools, but particularly starting out with families that engage in coercive social interactions, produce a cascade of developments that really are behind most of the problems that the human beings have. And so before I take you through this pathway, I want to point out that families that are high in coercive interactions are families that are experiencing poverty, which is a stressor that undermines parents' patience and their skill, but also discrimination. These are two major stressors that affect family life and result in this whole process. So what do I mean by coercive interactions? Well, imagine that mom says to Johnny, it's time to go to bed. And Johnny says, I don't want to go to bed. And mom backs off. Well, what just happened? Well, Johnny got reinforced because he ain't going to bed. And mom got reinforced because he stopped being nasty when she backed off. And there's a lot of research that shows that families that learn to use these coercive ways of reacting to each other are successful very often in getting people to stop doing things they don't like, but they don't develop the sort of warmer social graces that they need. And so what happens in these families is that the kids don't develop good self-regulation because parents aren't very good at making sure that they stop, that they control their emotions, that they, do the things that they need to do. And so what happens is that these kids are more likely to become aggressive and uncooperative. And when these kids get to school, these traits of aggressiveness and uncooperativeness and coercive behavior lead to academic failure, and they lead to peer rejection because the other kids don't like these kids very well. What happens when they get to middle school is that they meet other kids who have been similarly rejected by their peers and aren't doing well in school. And it's magic. They bond around the things that they don't like, with other people. And in fact, a very dear friend of mine who is since deceased, Tom DeShawn, did studies where he found kids who were at risk to have these kinds of problems. And these were all boys, and he had the boys bring a friend in. And so that those two kids were asked to talk about things that kids would be interested in. And what they found was that if the kids were talking about deviant behavior and the other person laughed, deviant talk, laughter, that predicted kids' likelihood of being arrested for delinquency 2 years later. So Tom was actually watching the development of deviant behavior in these studies. And so what happens then is that these deviant peer groups are places where drug abuse is common, depression is frequent, antisocial behavior is frequent, and also early childbearing is frequent. And that one I want to emphasize because, I talked about this as a developmental process, an evolutionary process, and it appears that human beings have evolved the tendency to develop these kinds of things and have their babies early. because in a dangerous world, you may not have time to wait to have your babies. You better have them early or you may not have them at all. And so this is a well-established developmental pathway, and it's the pathway that we need to prevent. And I'll tell you a lot about how we can do that. I want to mention one other thing. You see this line to cardiovascular disease? It turns out that these kinds of interactions in early childhood start physiological processes that lead to cardiovascular disease in later adulthood. And so, and here is a chart from a paper by Greg Miller and his colleagues that summarizes all this. And I won't go into great detail about it, but basically just these kinds of negative interactions with the child cause epigenetic markings. The epigenetics is the expression of genes that are caused by, in this case, caused by threat. And so what happens is that the physiological processes that are set off early in childhood continue through adulthood and make it more likely that people will have heart disease and strokes and tumor growth and frailty. And so if we want to have a society where everybody lives a long and healthy life, we need to be focused on reducing these kinds of experiences and thereby preventing all these physiological processes. So as I've studied this, I've sort of found I feel like everybody has to be, everybody needs a hug if a hug is what will work with you. And so, hugging the physiology isn't that appealing, but this is a picture of my son, Mike, and his son, Grayson, which at least for me, it warms my heart. And this is what we need. We need these kinds of caring, warm interactions. And it's not just human beings, by the way, because every organism is primed to look for and to seek safe, warm, caring environments. This is Charlie. He's well-fed, he's cared for, he's in the sunshine, everything's good. These are the things that every organism needs. And these are the things that we need to focus on creating in everybody's environment. And then I want to go back 2 slides because I also want to point out this. I want to emphasize child abuse and neglect, because child abuse and neglect is a risk factor for virtually every problem we would be concerned about. It's certainly associated with increased infant and child mortality, but it's also a risk factor for cardiovascular disease, stroke, asthma, COPD, cancer, kidney disease. All kinds of diseases are made more likely by exposure to abuse and neglect, as are psychological problems, severe mental illness, depression, anxiety, suicide, antisocial behavior, substance use, school shootings, academic failure. If we want to prevent all of these things, we need to increase our ability to prevent child abuse and neglect. So I'll come back to that and tell you a little later about things we can do about it. So one way of summarizing this would be to talk about what I've come to call the nurture consilience. And by consilience, I just mean a coming together of different groups of people that all come together around a point of view. And I would argue that this disciplines from biology, medicine, public health, social work, social and clinical and developmental psychology all converge in showing that people need nurturing conditions in order to promote their well-being. And so I find the concept of nurturance as sort of umbrella concept that is intended to, think about all of the ways in which we can make our environments nurturing and minimize toxic social and behavioral problems. And so here's what I mean by nurturing environments. First is that they need to minimize toxic biological and social conditions. Biological conditions like high levels of omega-6 in the diet or air pollution, but social conditions like the coercion that I was talking about in families and teasing and discrimination, all of these kinds of things have very specific harmful impact on people's well-being. And so in the interest of society, we need to prevent these things from happening. The second characteristic of nurturing environments is that they limit opportunities and influences for problem behavior. Opportunities like kids home alone without adult supervision after school has been shown to be a circumstance where kids might get into dad's liquor cabinet or otherwise try behaviors that they shouldn't be trying. But also we need to limit influences for problem behavior. And the ones that particularly I would emphasize are the marketing of tobacco, alcohol, unhealthful food, guns, fossil fuels, and pharmaceuticals that harm. And so we published a number of papers on that and the importance of not marketing these things, especially to young people. The third characteristic of nurturing environments is that they richly reinforce diverse forms of pro-social behavior, which is vital to the development of self-regulation. And I'm not talking about M&Ms and stickers. I'm talking about listening, caring, cooperating with, enjoying each other's company, and so on. These are the things that help people to develop not only self-regulation, but all kinds of skills. Almost any skill you teach a child is going to be to their benefit as they grow up. And the last one is to promote psychological flexibility. There's a huge amount of clinical psychological research that shows that when you help people to be mindful and clear about their values and enable them to pursue those values, even in the context of thoughts and feelings that get in the way, that has a tremendous benefit to people. So it's a matter of helping people to accept, in the sense of, okay, it's there and I can't do anything about it, accept the feelings and thoughts that you may have that might move you away from your the things that are important in your life. And in the context of being able to have those, you're able to pursue the things that are important, to live your values. And so there's been an enormous explosion of research in clinical psychology showing the value of this for people struggling with virtually any problem you might mention. And so he's come to the slow developmental pathway. This is one where there are conditions in which young people can develop good self-regulation, good language skills, good social skills. They get to school, they're more academically successful, they're more pro-social, they develop good friendships that support their pro-social development. And what do? You get compassionate, multiply skilled, resilient, and values-oriented people. And I submit that these are the sort of the basic things that we need to ensure that everyone in our societies, in our communities, are thriving. So next, I'm going to talk about the power of prevention. I'm just going to briefly summarize all of the things that we've learned in the last 40 years about how we can prevent the problems that we're talking about. And as I suggested, most of these things involve creating the nurturing environments that prevent diverse problems from developing. So this is a slide from the report of the National Academy of Medicine, the 2009 report that I mentioned earlier. And what it summarizes is through all of these developmental phases, these bracketed items refer to one or more programs that have been shown to significantly prevent problems. So there are pregnancy prevention programs, there are prenatal care programs, there are home visiting when a baby is born, there are early childhood interventions, parenting skills training programs, social and behavioral skills training programs in schools, classroom-based curricula that prevent substance use and aggressive behavior and risky sex. But there are also programs that can prevent depression, and programs that can prevent schizophrenia. So in addition, there are preventions focused on specific family adversities. So for example, if someone in the family dies unexpectedly, there are ways of helping those families cope with that. Or if there's a divorce in a family, nonetheless, there are programs that can help those families cope with that divorce without it harming young people. And there are also programs for people where a parent has some sort of drug or alcohol problem. And also programs when one or more of the parents have been incarcerated. In each of these cases, these programs have shown that they prevent problems, and they typically prevent multiple problems, and they typically prevent these problems for long after the program has been provided to people. And so this is a wealth of things that we have available, which unfortunately are not nearly as widely in use as they need to be. I'll also talk about community interventions, though I have a second talk that I'll get to that. But we also need to be aware of policies, which I'll talk about in a second talk. And policies that, for example, increasing the tax on cigarettes will significantly reduce the use of cigarette smoking. So it's one example. So anyway, and the other thing I want to mention is that most of these programs cost less than they save money. So in other words, there are programs that, a dollar's investment in that program might return $2, $3, $4, or even $50 to the society in terms of the prevention of problems and in terms of ensuring that young people develop the skills they can so that they can be productive members of society. So next, I'm going to talk about evidence-based parenting supports. So I'm going to describe what we have in the way of parenting supports. Over the last 40 years, there have been numerous studies developing approaches to helping parents to change the ways in which they're interacting with their kids in ways that help kids develop good self-regulation, help families develop much warmer, caring, and patient and skilled ways of interacting. So let's talk about that. There are at least 16 parenting support programs that have been shown to prevent substance use and related problems that are risk factors for substance use. So if you insist on only focusing on substance use, you should know that these programs make a difference in substance use, but you should be also aware of the fact that they're valuable for preventing virtually every problem with childhood and adolescence that we could be concerned about. And the key components of these programs are that they help parents replace harsh and inconsistent discipline with patient, clear, and consistent guidance. They build positive family support, and they increase effective parental monitoring, which is critical, especially as kids get older. The monitoring is, parents knowing where the kids are at, knowing what the kids are doing, and making sure that they're not getting involved in activities that are harmful to them and possibly to others. So there's a paper by Leslie et al. To describe 16 evidence-based programs, and these are 8 of those programs. And there are all kinds of approaches here. The Strong African American Families program was developed to help kids Black kids and boys in rural Georgia. And it helped the parents develop closer relationships with the kids. That led to the kids being less likely to use alcohol. There was less likely to be delinquent or criminal behavior. Truancy was reduced. School attendance was improved. And actually, this study showed that physiological measures of the sort that I was talking about that result from coercive family and school interventions, 9 years after this program was provided, the kids who got the program were significantly less likely to have physiological problems that are precursors to the development of cardiovascular disease and so on. So a really important program. Strengthening Families program. You can see that this one affected alcohol use, reduced antisocial and aggressive behavior, close relationships with parents was one of the results of it. Illicit drug use was reduced, internalizing problems like anxiety and depression was reduced, tobacco use was reduced. So, I could go through all of these, but the point is that all of these problems, pretty much by the same approaches, in the different programs, led to these really impressive outcomes. And so here's 8 of them, and here's another 8. And these two are programs that have had a considerable benefit. They've been used for, with parents that are adjudicated as abusing their children, and shown that they improve well-being and so on. And I'll just talk about a couple of them just to give you a more sense of their value. One of them is the Nurse-Family Partnership. This is a program that was developed to help young women who are at risk the first time they are pregnant. And these are high-risk moms. They're maybe not married. They're maybe living in poverty, and they're at risk to have problems with their kids. And so the Nurse-Family Partnership set up a system where when a young woman was pregnant, they tried to reach that woman as early in the pregnancy as they could, and a nurse helped them and would come to visit them at their home and help them work through what they needed to do to have a healthy baby. And so one of the first things the nurse would do would be to simply work with the young woman to try and help her get the social support she needed to, get through the pregnancy. So, think about a 16-year-old girl who discovers she's pregnant. Her boyfriend denies that it's his baby. There's a lot of tension there. The parents are very upset that she's pregnant. They're angry with her. And so she's now having all these stressors. And by the way, those stressors, even when the baby is not yet born, those stressors affect the mom and affect the baby. And so these are things you don't want. So what the nurse would do would be to first try and help her get the social support she needs. So she might say, well, is there anybody that you can turn to that would, actually be helpful? Well, I have this aunt, and she's really pretty positive. So, okay, how about if you reach out to her this week, and next week when I'm here, we'll see how it's going. And so she helps her build the social support she needs to get through this, and maybe figure out how to get the parents to, lighten up on the disapproval and increase their support and acceptance of what's there. And so the program would focus on the prenatal care, make sure that the mother got the prenatal care she needs. If the mother was smoking, smoking is a significant risk factor during pregnancy for the baby during pregnancy. So they would encourage them to quit smoking. When the baby was born, if you've ever had a baby, they cry and you're not sure, if you're new at this, you're not sure what to do. And so the nurse would help her to develop the systems of soothing the baby and rocking the baby and interacting with the baby. And just like you're seeing in this picture, which is actually one of the moms who was in this program. They also worked on contraception because there's a tendency for young women who have babies early to have a second pregnancy. And that's a big problem once, if you've just had a baby to, have another one. And so one of the things they did was they made sure that they used contraception, and they reduced the number of women who had a second baby right away. But also they worked with the woman on her work life, and they started this early, during the pregnancy. Well, okay, so what are you going to do about your education? Where would you like to get to? What would, and so they'd help them develop, goals with respect to where they wanted to go. And they were very encouraging that the young woman could achieve those goals. So they made sure that they continued to get their education. And so this is the nurse-family partnership. And they evaluated this initially in 3 randomized trials for poor teenage single moms. And I haven't actually said anything about randomized trials. So let me just say that randomized trials are the method that has gotten us to all of the progress we've made. If you recall the slide I showed of all of the things that have worked, virtually every one of those, when I say it worked on the basis of some people were randomized to get the program and some people were randomized to not get it. And the people who were randomized to get it did much better than the people who weren't randomized to get it. So here's 3 randomized trials of this family checkup for the nurse-family partnership. I'm sorry. So it had significant effects on abuse and neglect. The number of kids who were reported in hospitals to have, been abused, there's significantly fewer of those among the families that got the nurse-family partnership. The children's behavioral development was significantly improved. Even 15 years later, the kids who got this program were doing better in terms of their behavioral development. The mother's economic well-being was significantly better than the mothers who didn't get this program. And as I said, time to the next baby was increased so that they didn't immediately have another baby, which would add to the stress and undermine the well-being of both of those babies. And children's arrests as adolescents were significantly lower than they were for kids whose parents didn't get the nurse-family partnership. So that's one of the programs. Here's the Positive Parenting Program, or Triple P. This is a program that was developed, and really one of the first programs that decided that they would try to have an effect, not simply on the people who show up to a clinic, but they would try to have an effect on the entire population of families. And so they developed a program with a community-wide system of parenting supports that included brief media communications. So just, putting in the media, here are the things you can do and here are the things you shouldn't do, influenced parents to, do a more nurturing job of parenting. But, there was also brief advice for specific problems. And so they developed tip sheets. So, you can't get your baby to go to sleep. Well, here are some things you could try. Now, I'm going to give you this tip sheet and try it, and we'll talk next time. And so they reached parents through preschool teachers and physicians and so on. And that was actually turned out to be probably the most important thing they did, because they reached a lot of parents of kids. These are preschool kids. They reached a lot of them. And helping them develop approaches to specific problems. So, for example, if you got a baby who you can't get to sleep at night, then you get a tip sheet that helps you get that baby to sleep. Well, that actually may prevent all kinds of other problems, because the child is not getting good sleep. They're harder to manage. And maybe parents get angry with them, which is counterproductive. And so by preventing that problem, you may be preventing the development of other problems. And so every time they gave parents some new skills, those skills were useful not only for the problem that they had, but for other problems. And so the parents were becoming more skilled. And then they had available more extensive interventions where they could actually meet with a therapist and work through it. But most of the effect in this study was via the brief advice for specific problems. And so they did multiple randomized trials that showed the benefit of it. But the one that I'm describing that was done in South Carolina, where in 9 counties, they implemented this community-wide program, and in 9 they didn't. And what they found was that there was a significantly lower rate of hospital-reported child abuse in the counties where they had provided the positive parenting program. And this, by the way, is a program that is in something like 70 countries around the world. It's been widely disseminated. And so here we have another slide that's reminding you that there's substantiated child maltreatment was significantly less for the families that got the triple P positive parenting program. And so, and again, those are 2 I showed you, but there are 16. If you have a community that you want to reduce child abuse and neglect and improve the outcomes for kids, you should be working to get one or more of these programs made available to families. And so there's a lot more that you could learn about this. And if you email me at tony@ori.org, I'd be happy to steer you to some of these programs. I'd be happy to help you get your community to implement one or more of these programs, because this is the future of a nurturing society, is getting these used. But now we're going to talk about evidence-based school interventions, because that's the other thing that can make a significant difference in preventing substance use and all the other problems. And so here we go. So here's just a list of some of the programs. These are the ones that are starred with an asterisk, which is basically every one of these, are ones that have reduced substance use. But they've also produced many other benefits. So there's life skills training, there's positive action, there's providing alternative thinking strategies, or the PATHS program, positive behavior intervention and support, which is in thousands of schools nationwide. There's the social development, Seattle Social Development Program. There's the PACS Good Behavior Game. There's cooperative learning. All of these have been shown to reduce substance use, but they have many other benefits. So let me just talk about 2 of them. One of them is the Good Behavior Game. So the Good Behavior Game has been around for probably 60 years. It started with a teacher who was a new teacher. She and her husband had just moved to Lawrence, Kansas, at the University of Kansas, because he was going to be a graduate student in the Department of Human Development, and she was going to be a teacher who would actually make the money and keep the family supported. And so she had, I think it was a 3rd grade, and there were 3 3rd grades in the school, and the teachers from the previous year had allocated the kids to the 3 classrooms. So guess which classroom she got? She got the classroom that they'd allocate all of the difficult kids. So by Thanksgiving, she's tearing her hair out. She's ready to quit. And that's probably not a good thing for the husband. So they went and they sat down with one of the faculty members in the Department of Human Development, and they started talking about, well, what could you do to improve the behavior of these kids? And they came up with the idea that, well, when the kids were having like a spelling bee and there was a contest and so on, they were sort of well behaved. So they decided that they'd see if they could play a game where, if the kids in the group that was playing the game were on task and not being disruptive and so on, they'd get a reward. And so they tried that first in language arts, and then they tried it in math. And what they found was that the disruptive behavior went way down when they were playing this game. And the way the game worked was, if everybody in the group that was playing this game, they had a small number of disruptive behaviors, then they get a reward. And typically the rewards were things like an extra 5 minutes of recess. It significantly reduced these problems. So there were numerous studies over 40 years showing the benefit of this. But they'd never done a randomized trial. And so a psychiatrist at Johns Hopkins University, Shep Kellum, decided that he would try this and see if it could make a difference in 1st and 2nd grade kids in inner city Baltimore. These are, kids in high-risk neighborhoods and so on. So they randomized kids to either get the good behavior game or not get the good behavior game. And what they found was that there were significant benefits. And I think I have this slide. And then what they found was that in the first month, there was more time for teaching and learning because you didn't have a lot of, no, you need to sit down. No, you need to sit down. They got the kids much more likely to just get together. So there was more time for teaching and learning. There was less stress for staff and students. In the first year, there was better attendance, fewer referrals, fewer service needs, less illness, happier families, less vandalism, better academics. 2 to 3 years later, there were lower levels of ADHD and oppositional defiance and less special education needed. 5 to 15 years later, they followed these kids into middle school and discovered that the kids who got the good behavior game just in first and second grade were less likely to use tobacco and alcohol. There were fewer conduct disorders. There was less depression. They followed these kids into post-high school and found that the kids who had gotten the good behavior game just in first and second grade were significantly more likely to graduate high school, to attend college. They were less likely to have problems with substance use. They were less likely to have problems with suicidality and depression. And so the benefits of this were huge. It was like $1 invested in this program had $54 in savings associated with it. Because there were fewer people that were getting into the criminal justice system. There were fewer people who were having problems that you need, or incarceration and all kinds of problems that occurred among the kids who didn't get the program. So it's a very powerful program. So a friend of mine, Dennis Embry, I took this program. And he decided that the way it was written up in Shep's manual, it was difficult to get teachers to do it. So he developed an approach to training teachers, and he added a bunch of things to the program. And the things he added, he called kernels, which are simple behavior influence techniques that added to the benefit of this. And I don't have time to go into it in great detail, but if you're interested, if you send me an email at tony@ori.org, I will tell you all about I'll give you more information about the program. And you should know that I have a contractual arrangement, the Paxis Institute that does the PAX Good Behavior Game, PAX for Peace, Health, Happiness, and Productivity. We have some funds that they provide to do further work on this program. So, conflict of interest, now you can make up your own decisions about what you think about that. But the PAX Good Behavior Game adds these kernels. So for example, PAX Vision is a one where the teacher simply asks the kids, if this were the most wonderful classroom you've ever been in, what would you see, hear, feel, and do more of? What would you see, hear, and feel, do less of? And so the kids are participating in saying what they want their classroom to be about. And that then becomes not some dead poster that is just up on the wall, but something that they use every day to say, okay, so we're going to walk over to the lunchroom. And so what would be some PACs we'd want to see, positive behaviors? And what are some spleens we don't want to see? Spleens is Dennis's made up word for bad behavior. It's better than bad behavior. It's just, okay, these are things we don't want to do. No big deal, but we just don't want to do them. And so that becomes the thing that's guiding the development of behavior and creating a culture in the classroom of cooperation. PAX Quiet is one where the teacher toots on a harmonica and the kids learn that when they hear the harmonica, they turn and they make the peace sign and they pay attention to the teacher. I've seen principals describing how I was in the gym the other day with all the kids in the school, and I just tooted on the harmonica and everybody got quiet. Teachers love that. Tootle notes are just praise notes. Granny's wacky prizes are the things that kids get after they've cooperated. If each of they typically make teams of 4 people. If each of the 4 kids, they have 3 or fewer disruptive behaviors during the time of the game, then they get a Granny's wacky prize. And they're all things that they don't cost any money. They don't involve any food. They're simply things kids get to do that they wouldn't be allowed to do typically in a school, like you can all turn your chairs around. I've been in classrooms where that was announced and everybody stood up, turned their chair around and sat backwards on their chair. And they do that for 5 minutes and that's the reward. Pack sticks are just popsicle sticks that with people's names on it, and you simply use those to make sure that everybody gets to participate. And so I'm going to go on and talk some more about the benefits of this. This is an independent analysis of the benefit to cost ratio for the good behavior game that showed for every dollar spent on it, there's a return on investment of $62.80. Remember those kids that graduated high school and made more money because they graduated high school than the kids who didn't? That's part of what they did, but they also prevented criminal justice activities, depression, and so on. Huge benefits of the program. Hopefully I'm convincing you that there are these programs that are, good ones that we can make a difference. Another one is cooperative learning. And here too, I don't have a financial arrangement with this, but the research I'm going to describe here was done by my good friend, Mark Van Ryzen. And it's just another example of how you can create environments where kids are cooperating and learning. So this is a program that's been around for, again, for something like 40 years. And mostly the research showed that if you teach kids to work cooperatively, so that you have like a group of 4 and we're studying, let's say we're studying the American federal system, you might have some kids who are responsible for, well, what does the Congress do? And another kids who are responsible for what does the president do? And a third might be focused on, another kid might be focused, 1 or 2 kids focused on the Supreme Court. So they're learning about these things, but they each contribute something. And so they have to say what the whole thing is. And so they cooperate to do that. So it's a small group form of instruction. Each member of a group has a special role or task. Group members are incentivized to collaborate, because if I collaborate with others, then we'll all get good grades. And so, whether you're a really stellar student or not so stellar student, I have an interest in the other kids in the class have an interest in everybody succeeding. And so it promotes pro-social relations among the kids. And there are also opportunities for post-lesson reflection on, well, how did this work? And it's helping kids to get better at cooperating and so on. It can be used in any subject at any grade level. So this is not something that is, well, we're going to stop teaching you stuff and we're going to work on your appropriate behavior, or we're going to talk about substance use and so on. There's no mention of any of those things. It's just teaching kids to get along and cooperate. And so teachers can adapt to existing curricula, and Mark has an app that helps them to do that. And the research finds strong benefits on academic achievement, positive peer relations, and so much more. The thing I want to emphasize here is that what Mark has found is that the kids who are more likely to be marginalized, they're not such good students, or they're poor, or they're different, or they're a different race or ethnicity than most of the kids and so on, they get accepted because they're all benefiting from cooperating together. And so what he has found in randomized trials is that kids who would otherwise be on a trajectory to be rejected and get into antisocial behavior are more accepted, and they're less likely to be involved in substance use. They're less likely to be distressed, anxious, depressed. It's a very valuable program, and it all is about social acceptance. Other tested and effective school-based programs, the life skills training, positive action, and the PATHS program are ones that, I would highly recommend you look into. So the key component of all of these programs is social acceptance. When I was doing research on cigarette smoking, I'd done a lot of studies, but one of the things I realized when I was asked to be an expert witness in U.S. versus Philip Morris et al., I was asked to read research of the tobacco industry on how to market to kids. And what I realized is that they're not selling cigarettes by saying, oh, you'll have these good feelings when you smoke. In fact, when you start smoking, it's actually pretty aversive. The way they get kids to smoke is they show them social acceptance. And so the success of the Marlboro Man, which was the best-selling cigarette to kids for many, many years, was that they showed these people smoking Marlboros who were tough and rugged and popular and liked by other people. And I realized in studying this that, wait a minute, the way this works is that you're telling me that if I smoke this cigarette, I will be more popular. Okay. But the other thing is that the advertising is telling everybody else that this kid who smokes cigarettes is a really cool person. And so it kind of helps in both ways. And so we realized this and we said, wait, we've been focusing on sort of getting kids to know that cigarettes aren't good for you and so on. Forget it. We started focusing on making sure that every kid was in a group that was working on against tobacco, but we didn't do much about the cigarettes. We just made sure that that marginalized kids were included in these activities and they were accepted in these activities. We got the biggest impact we've ever had in reducing smoking. Social acceptance is the key. Why do kids engage in problem behavior? Because they're rejected by their peers and they become friends with other rejected kids, as I said earlier. And so what we need to do in all of these programs is make sure that kids are being accepted and succeeding. So okay, so I'm getting close to the end here. You may be pleased to know that. Lessons from the states that have done better than Oregon. Okay, this is basically the reason that I've made this program, because I've known about this for a while, but I recently attended a meeting where I was reminded about how much better some other states are than Oregon in terms of reducing these problems. So, state of Washington, right north of us. I've been friends with the people who developed the programs, developed Communities that Care program, and have watched as they have helped Washington and states all around the country use these organizing principles to make a significant difference. So, Communities that Care used community organizing principles to educate community leaders about prevention. And so they organized and got the leadership of the community to understand that all of these problems that they're concerned about result from the kinds of things that I've talked about, and that what they needed was to implement family and school interventions that would prevent these problems from happening. And they did this very systematically. So they got it widely implemented in Washington and tested it in randomized trial in communities around the country. And so some communities got the program and some didn't. And at one point it was being used, by the way, in Oregon, but this effort withered for reasons that I do not know. And so, so they got this evidence. And since then, they used that and built a system of prevention that's working in every community in the state of Washington. They've systematically gotten at least one family and one school intervention in every community in Washington. And their success was due in large part to close collaboration between the state government and the research community. The people at the University of Washington and Washington State have experts in prevention science, and they work with the state to use this stuff to make a difference throughout the state. And by the way, their prevention scientists are no more prolific or well-funded and well-published than those in Oregon. But Oregon has failed to use this knowledge in a way that would work, which is why I'm talking about this. So then there was Pennsylvania. So some of the people in the state of Washington began to work with the people in the research center at Penn State. And Penn State similarly worked with state government to implement Communities that Care in every county. Each community was educated about the effective prevention, and was guided to choose one family intervention and one school intervention. And by the way, giving people a choice increases their adoption. So rather than say, you got to use this program, here are some programs that could help. Which one would you like to try? And so people are more likely to do things when they're given a choice. There's a lot of research on that. Over the ensuing 15 years, the Research Center and state government brought in a total of 17 evidence-based preventive interventions and promoted their adoption. I recently attended a meeting where some of the people from Pennsylvania reported on what they had done, and they, continually put money into this. The Research Center got funds from the federal government for this. The state put money into it, and they continued to refine and improve this program. And in fact, here is a list of some of the programs that they implemented. And just, they kept putting these programs in, and I've already described some of them: the Strengthening Families program, the multi-system. Well, I haven't described all of these, but if you're interested, I can learn about these. So they're teaching people in the communities how to use these programs. They're teaching the preventionists in each community about how to implement these programs, and they're getting them implemented, and they're reaching a lot of people. And here are more. In 2015, they added positive action, the Strong African American Families, the Family Fuertes Hispanic program, trauma-focused cognitive behavioral therapy, adding these programs and making sure that they're reaching as many people as possible. 16 years after they began the work in Pennsylvania, they assessed adolescent problem behavior in all 388 school districts. Districts that used communities that care had significantly lower levels of adolescent substance use, delinquency, and depression. Notice it had an effect on all of these things. We can do that as well. As a result, Pennsylvania has a much lower level of adolescent substance use in Oregon. And by the way, I've looked at the data, and in Oregon, it's actually been going up. In Pennsylvania, it's 16 years, it's been going down. We could do this in Oregon. So I will go to this. Colorado, by the way, has adopted the approach that worked in Pennsylvania, and that's thankfully largely to Brian Bumbarger, who led the efforts in Pennsylvania before moving to Colorado. So in sum, adolescent substance use is highly correlated with other problem behavior. This means that we're unlikely to significantly reduce substance use if we do not prevent related problems. The good news is that preventing problems as diverse as academic failure, depression, antisocial behavior, and I should add child abuse and neglect, will contribute to preventing substance use. So all of these things are relevant to preventing substance use. A state that systematically implements evidence-based prevention in its communities will see significant reductions in all of the most common and costly problems of childhood and adolescence. Getting evidence-based family and school programs adopted in every community is the bedrock of effective prevention. I hope that I've made this crystal clear, and I hope that a few of you are saying, hey, we could do this. And a second talk will describe the policies and programs that communities can adopt that will further efforts to prevent multiple problems. And a final thought: you are the key to building a community that nurtures everyone's well-being. If you're working in prevention, you are on the cutting edge of bringing about a society, a community, a state that is nurturing the well-being of every person, and you can make a difference. And the last thing I'll say is that the nonprofit that I created, Values to Action, was created to help communities do this. And if you would like to get your community moving in this direction, we are happy to partner with you to try and get the funds to support something along the lines of the communities that care, that brings these programs to bear in communities, because we can make a huge difference in the well-being of every person. Well, I hope you found this talk useful to you. If you did, you might consider joining Values to Action. We can help you create action circles that help your community become more effective in nurturing well-being and in preventing the problems that plague so many communities. We can partner with you to obtain funding to address the problems community members are most concerned about. And you can help Values to Action advance the social movement that can end the inequality and equities that exist throughout this country. So join us in making a more nurturing community, making a more nurturing world. Thank you.